please. Good morning.
Good morning, sir.
Prosper. Good morning.
Good morning, sir.
All right. We are still on the course PP111, Principles of Commerce Technician Practice. We are done with the course outline. As I told you, that from today, every contact you have from now till your exam, anytime you see me in your class, the first thing is to write quiz. After that, we do revision, look at questions. All these revision questions I'll be posting, you look at them. I will just be asking questions, then it's going to be a kind of interactive class, no longer lecture now. Am I communicating?
Yes, sir.
So we just interact, rub minds. So that's what we're doing from now till your what? Examination. Alright, for the MDEX, the company called me today that they just resumed today that it will be tomorrow. So from what they told me this morning, that it will be sent tomorrow. So let's hope that we have the MDEX. For those that are interested in this batch, you can still make your payments from now till at least in the morning. If once it's tomorrow morning, and even if you pay, if they are already on their way, that means it cannot work. To two of us, you enter the next what? Batch. But if you pay and they are still in their office, they can still transfer, can still be made, they can say adios. So that's the information I want to give us with respect to those interested in MDEX. Okay, and the another thing I want to let you know is that there will always be mock-up. So those that do not write will now sit one-on-one. You face me and write one-on-one. I want to know what you do. I have preferred you in the first part of the first semester. Now I want to know what to do. It's now that the real people that have it here will showcase themselves. And no more hiding in the crowd. That era has what? Ended. So now I want to know what you know. So if once I'm here, once I start the quiz, you don't enter. And if your phone has issue, don't worry, wait, calm down. You will say right. I will make out time, we'll sit one-on-one, then you write. I will see you writing it. Am I communicating? So if you still want to hide in the midst of some people here, of course, if you do like this, I'll catch you. And from Thursday, please, once I drop the question enters your WhatsApp, please, your data should be off. If I come across and see your data on, is exam malpractice. You will score 0. Once it enters, you don't need data again. Two of us. Your data should be what? Off. Don't be doing like this up and down. Your data should be what? Off. Once the question drops, your data should be off. So if you hear quiz, please study. It's no longer will come. You do as if you want to do what you don't know. That era has. I want to know what you want to know so that I will know exactly what I'm doing. Because we have like two months. Sorry, 1 month to exam, right? And so if I see your scores in quiz, it will give me an idea of what is happening, what is your issue. I will not call you and know your problem. But if you hide and be scoring 20, I think you know it. You go to the exam and embarrass yourself. No. Am I communicating? Because it's funny. If you are scoring 20, 18, and exam you are scoring nonsense score. You saw how much two of us. Those that see this here will be thinking that I am adding mark for you. Two of us. Yeah. So if you are doing well, do well for real. Know it. It should be in your head. And told you I must force it to enter your head. Unless you don't want to pass. What I like it already, enter this in your head. and you have what it takes for you to enter. You see, they don't want to make use of it. God has blessed you with everything it takes for this your head to be, for you to enter. It must enter. There's no choice. You have no choice unless you don't pass through it. Pass through it must enter. If not, you keep writing receipt all the time. It must enter. There's no two ways about that. I'm sorry, that's who I am. There's no two ways about that. So better start buckling up. And why I'm doing that is that I'm sure that we are blessed. You see that I don't want to make use of it. Am I communicating? I am very sure of that. You may not be like somebody else. There may be categories, okay? This one is better than me, but it's there. It's there. It's there. Until you sit down and start asking yourself a question, what is the issue? Then you start seeing why it has not been, you are not be doing well. Maybe because there are one or two factors. It's not that you don't have it, you have it. Because God the Creator knows what He's doing. Am I committing? You have it. Okay, that's for the CA. Okay, let's see what we can do. There's no particular order, just any question I see, any question that comes to my mind, I will just. So don't expect me to. If you want to write, write. If you don't want to write, if you just want to listen, listen. Okay, question number 1. What is the legal definition of a poison in pharmacy? What is the legal definition of a poison in pharmacy? Without the option, this one is easy now, right? Without the option, right? Is easy, right? Option A says a substance causing minor harm. B says a substance causing severe organ damage or death. C says a substance causing temporary disability. D says a substance causing allergic reaction. What's the answer?
B.
B is what?
A
substance causing severe organ. Good. A substance causing severe organ damage or death. Please silence your phones, please. Number 2 says, which part of the poison list requires sale under pharmacist supervision? As in, it must be, it's a must. Am I completing? Yes. When you see require, what it means that it's a must. That's the meaning of that require there. Am I completing? It's a must. They're nothing like this one, but it's a must. Pharmacist must be involved. If not, forget about it. It cannot be what? Dispensed or so. That's the meaning. So we have part 1, part 2, both part 1 and part 2. Either part 1 or part 2 is what? Part what? The third one says, what is an example of a part 1 poison? A. Ammonia. B. Arsenic. C. Hydrochloric acid. D. Nicotine. Wow. These guys are ready for this exam. Yes. I can feel it.
Twist that question.
Twist it.
I want to again.
Twist it.
I twist that. You twist again.
Your question is easy. When it does not come, the two will not be.
Let's start from the easy to what? We still have 1 month to go. Sure, you know. Calm down. Another one will get there. You build from the known to the what? Unknown. From the easy to the what?
Difficult.
Number 5 says nicotine is derived from where? A. Opium, cannabis, and cocoa leaf plant. B. Synthetic substances only. C. Natural plants only. D. Animal products. Opium, right?
Yes.
Cannabis and cocoa leaves. Good. What is the purpose of scheduling controlled substances? A. To restrict medical use. B. To ensure availability for medical and scientific purposes.
B.
C. Now let me go all the options.
No need.
No need.
Don't stress yourself.
Okay. Oh, this is how you be saying no need, no need. Listen carefully. Don't listen. Listen carefully. Let me say something. They are not like, see, if you are giving an example, be careful in my OBJ. If you are giving an exam question, calm down. No. Go through the options. Calm down, don't rush, don't see guru, you jump and answer. Am I competing? Calm down, don't rush. Look at all the options. That's what I mean by don't rush. Look at all the what? Options. So calm down, let me call all the options before you decide. C says, sorry. Yes, C says to promote substance abuse. D says to ignore addiction potential. What's the answer?
B.
To ensure availability of what? For medical what? Scientific purposes. I agree with you. Next one says, what are psychotropic substances? A. Drugs affecting the central nervous system. B. B. Drugs affecting the respiratory system. C. Drugs affecting the cardiovascular system. D. Drugs affecting the digestive system. I agree with you. Drugs affecting the what? Central nervous what? System. Number 8 says, what are precursors? What are precursors? Raw materials.
Yes.
Okay. A. Finished pharmaceutical products. B. Raw materials for drug production. C. Intermediate substances. D. Waste products. The answer is what?
Raw materials for drug production.
Which is B, right? Good. Number 9 says, which convention categorizes or classifies narcotics? UN what? Single convention on what?
On narcotics.
I agree with you. Other option says UN Convention on Psychotropic Substances, Pharmaceutical Convention, Medical Convention. The answer is UN Single what? Convention on what? Narcotics. Next question says, what is an example of a nationally controlled drug in Nigeria? A. Amitriptyline. B. What? Amphetamine. C. Vitamin C and D. Fentanyl. 11 says, what is the primary role? What is the primary role of mass technicians in healthcare team? A says to diagnose patients. B to dispense medication and assist pharmacists. C to manage patient records. D to provide medical billing services.
B.
That's the primary, okay?
Yes.
That's the primary. That's the primary. C. There's a clue I want to give you on answering OBJ question. Please, if you are giving OBJ question, I think I've said it before now. Good morning. Go through, or you may see the question. Try to understand the question first. Some question you may see it, there may be not there without you knowing. You rush through and start thinking nonsense. Then some question, if you look at the option, just go through all the options. OBJ answers. Sometimes the answer may not be absolute. Sometimes the answer may be what? Relative. Am I communicating? See what I mean by relative? With respect to all the other options, the most appropriate is the answer. Sometimes there's some question you may see. The options, if you look at it absolutely, the options may be the same thing. But with when you want to do it what? Relatively, the most appropriate of them is what? The answer. Those that have written jam will understand this better. Am I competing?
Yes.
So be careful, don't just so some of you, when I give you questions, they say, sir, all of them are the answer. I will just be laughing at you. Calm down. Look at the question. Is there no doesn't sometimes when it comes to patient records, keeping record of drugs you give, is that not a record?
Yes.
Be careful. Am I communicating? But the primary, see that adjective. Primary has changed a lot of things. Am I communicating?
Yes, sir.
They didn't ask you role. They said the primary role. What it means that if a pharmacy technician leaves that one and be busy gallivanting with other things, that person is not a pharmacy what? Technician. Am I communicating? You're just as a pharmacy technician, you leave your primary role of assisting pharmacist and the dispensing, as you see, for pharmacist and what? Maybe dispensing, depending on this setting. You know how to check BP, right? Wonderful. You even know how to do one of the things in the hospital, and you leave that one, and you're busy going to be checking BP. Are you normal? Are you a pharmacy what? Technician. But you can do that one, share. But that is not your primary what? Role. So be careful with answering questions. Don't just boom. Because boom. Maybe you cram your notes. Boom. You should go and start. Sir is not here. Sir, this is not this is not this thing. And that's what happens to some of you in your mass seriousness exam. And this question is wrong. It's wrong. And after they were getting nonsense score over that, after settling me, it's wrong. How can you say that it's wrong? Be careful. After cramming, no. Reason. Do what? Reason. Because the challenges you are going to meet demands you to do what? If you wake up to go to where you work, maybe in community pharmacy, you don't need to know who you're going to meet. Challenge. So if you don't know what it means to reason, and I was even here correcting them. It's not that they were saying I do it, and now at the end I said, please, solve this. They insisted. I saw some. They were busy doing what I asked them not to do, and at the end, so we're scoring for. See, nonsense. Does it make sense? It makes sense. And I will use this style to say, please, this is not what you do. They didn't listen. They were even seeing me as a distraction, that I don't know what I'm doing. So how can you say that this question is correct? It's wrong. How can you say that mathematics is for you to solve? A figure can be changed. Hope you know.
Yes.
What matters to show that you know that thing, that figure that was changed. You know how to apply the formula, the steps, the principle, and solve it, even though the figure was what? Changed. And get the answer. That means you know it. But if you go and cram that one you were given in class, that's what some people do. Anyway, this is not mathematics class. Let go back to. I'm just using it to tell you something that you need to do what? You think out of the what? Box. That's the point I'm trying to make. Alright, so now, the next question. So the answer is saying to display medication and assist what? The next one, with whom do pharmacy technicians collaborate on medication administration and management? A, from physicians. B, nurses. C, dietitians, and what? D, what? Administrative staff. What is the answer? Yes. Good. And nurses, right?
Yeah.
Medication administration and what? Management. Yes, because they will come to you. Some will come to you as pharmacy technician. They will ask you. It may be those on IT. It may be those on experience. They may come to you. So, please, look at these things. So may quietly come to you. Maybe they may not want to go and start because maybe it's what they ask, what they to know. Because they do drug calculation. Their own, they call it drug calculation. We call our own pharmaceutical what? Calculation. The person may come to you. please, man, this meal, how many meal will I give? How many meal will I do what? Administer. Or you may ask one or two questions with respect to drug what? Therapy. If you're not informed, you will deform yourself and deform her and deform the patient. Am I communicating? So that's why you're here to be what? Informed. So if you're the type that cram notes, what this one now, they're nothing to cram here. You need to apply what you have learned now to be able to do what? Help out in that what? Situation. So now when it has to do with any business with respect to drug administration or whatever, some people ask you, please, what can I use to? Some may ask you that question. I've seen it. Am I committed? Maybe how to what about the constitution, or why do we even some may want to ask you thought-provoking what questions. They are people that know how to ask questions. Maybe they want to know. Why do we even reconstitute this thing? Why didn't they produce it like this? This is purely from a school what question, and that's why you do what dispensing. Okay. So what are you going to do? You say it is where it is, even though it's not necessary the person's what jurisdiction. Maybe the person may be a nurse. It may not be, but at least you should be able to do what say something correct, not something wrong. All right. So the next person say, what is essential for effective relationship between pharmacy technicians and other health care professionals? What is essential for effective relationship between pharmacy technicians and other health care professionals? A. Only communication. B. Only collaboration. C. Communication, collaboration, mutual respect, trust and flexibility. D. Only role definition. What's the answer?
C.
Communication, collaboration, mutual respect, trust and what? Flexibility. We have discussed that in detail in your class. So, what is the benefit of strong relationship between pharmacy technicians and other healthcare professionals? What is the benefits? In another way around, which of the following is a what? Benefit of a strong relationship between pharmacy technicians and other healthcare professionals? A. Reduced job satisfaction. B. Increased errors. C. Improve patient outcome. Anybody that fails this one should be flawed. D. Decrease what? Resource what? What's the answer? C. Improve patient what? No matter who you think you are, you are a doctor, you are a pharmacist, we are those that know about drug. When it comes to drug, we are the custody of drug. Doctors will do their own. In the hospital, if it's not us, you are wasting your time. Nurse will see. Without us, you can't even do anything. All these things you people are dragging. Medical officers come and say, if we want to give you nonsense result, your treatment will not say. At the end of the whole thing, all of us should work together to do what? Improve patient what? That should be where our eyes should be. Our target should be not who is who and who is the organ of the hospital. Who is the organ? Who is professional that without healthcare, without them, healthcare is nonsense. No, that's not what the person is. What the person wants is let me be well and do what? Okay. So that should be your what? Target. And for you to achieve that, you must learn how to do what? Work with others. Forget your ego. Put it down. Forget how many years you have spent. Forget how many years you have spent in the higher institution studying drug. All those are nonsense. You must work with them to be able to do what? Help the what? Patient. Because if two elephants are fighting, what suffers? The what? The grass. So if you are busy fighting, dragging who is this and this, the patient will do what? Suffer. So that's the point I'm trying to make here. So the answer is what? Improve patient outcome. Who do pharmacy technicians interact with to address patient social and emotional needs? How are you? Social workers. Yeah. Eh? If you go to university, when I was in my first year, one of my roommates that was studying social work was like, what do you social work? You know, we be the, you know, now I was just doing nonsense. Social work. So someone cannot just sit down and write down and say you want to go and study social work. I was just I didn't understand it. It was when I came up. And I started, you know, studying, learning things about the practice here and the practice outside or in the other part of the world. I now realize that social workers are very, very important in healthcare world. In healthcare world. Yes. But here I don't even know. Here I don't know whether they have been fully integrated. Last I worked in the hospital, I did not see any social worker there. I did not see any. Unless now, in the long address patient's social and are you aware that there are some issues a patient may be having? It may not be, it may be social issue that translated to that. From there, psychologically, from there you see patient dying, depression setting. Are you aware? Okay, they are there, fine. You know, it's been long I left hospital setting. They are there, right? Good.
Actually, have this.
The psychologists are
Social workers, we have been about.
good. Are you aware that your social life has a very important role to play even with your mental health?
Yes.
Good morning, sir.
Good morning.
Sorry, I didn't Your name looks like India.
India, is there?
I'm from India. How did you guys resolve it? I just want to know. Just the one that you have. And that's what you have done now. After all, my class is not an in-course.
He's not. I was just doing what he asked me. Contacting.
How are you?
Please do that too. Huh? He's not happy. Huh?
Sir?
I said he's not happy.
Sure.
Do that, please.
Sure.
All right. So they are very, very important. Your social life, the interaction with people around you, the vibe they give you, has a lot to do with your mental health. And if you're not careful, your ill mental health can translate to depression. From depression, stress, some may give you stress. From stress, you see yourself developing pathophysiological issues. Like blood pressure will start rising. Am I completing? You see yourself, before what's going on, stroke, the person is down. Before you say Jack Robinson, the person is already in the mortuary. You see where it started. You see how it started. So please, people around you should be the people that help to improve their mental health. No matter who that person is. If the person around you is not giving you what to help you to be okay, balance, it's cut off and go your way. Do what? Cut off. If you go, you don't go. If you go, you don't do it. And you self, don't stop prognosing in things that doesn't concern you. Everything you put here, you want to know about it. You want to know this. One day you put your head to know. From there, you may not come back. Am I completing? You know the one that give you heart attack. Hello. Let's continue, please. So, if you are going to see the importance of words, your social network is very important. Okay? Very, very important. And don't put your head in what you cannot carry. What you cannot carry, don't do what? Don't say God will see me through. Before you start to ask them, can I do this thing? There's a great difference between that. You are aware you cannot do this, and put your head that you are doing it already. With along the line, it's suddenly becoming what? Difficult. You start looking for a way to do what? Manage, hoping that God will see you through. But even when you are trying to manage and it's not working, do what? Quit. Do what? Quit. Don't die there. Hello? Quit. You try, it's not working. You try again, it's not working. You see yourself, you are going down all the time, and you keep crying. God may also be telling you, my daughter, my son, this is not for you. It's also another way of telling you that it's not for you. It comes across all aspects of what? Life. Sorry, this is not science, but it's also important to we know this. This human beings, they are making noise. Is it here or off? It's up. Tell those human beings up. Tell those human beings up there that are studying in class. Please tell them that if I come there, they will not be happy with me. And I want to be sent. Now, the next one says, what is a challenge that pharmacy technician may face in their relationship with other healthcare professionals? What challenge, or what is a challenge that pharmacy technicians may face in their relationship with other healthcare professionals? A. Cultural and language barriers. B. Only communication breakdowns. C. Only role confusion. D. All of the above. Yeah, sometimes there can be cultural and language what? Barrier. Am I communicating? Yes. Yes, sometimes there can be cultural and even though we have common language used, official language, but even in that official language, you come in an official setting, you see one human being speaking to you in their what? Language. We have official language, official list, and suitable one that all of us will understand. You see one human being trying to talk to you, talking to you in their own what? Language. To his mind, his or her mind, he wants you to learn how to speak that. That is foolishness. Becoming now auntie, a brother, is official what? Setting. Use official what? If you are doing your friendship, whatever, outside official setting, you can maybe you know it gives joy seeing some other person, some other person using your what? Language. Hope you know. There is joy it gives. Maybe the person is in your own land. You are not. No, it's wrong. His selfishness is wrong. After official work, if the person is your friend, you can go outside and teach person your language. Am I complete? But so far you are an official listing, it affects the what? The work without you even what? Knowing. Am I complete? Without you even knowing. Then cultural listing can also cause it. Then confusion, as I say, a small secretary that should be busy looking for how to study the drugs in the shelf or in the store and how to manage the drug listing. He's busy going to where to check the BP. He's confused. They confuse what? Human being. Am I competing? You leave your work and start doing the work of a nurse or a doctor. Maybe because you did one nursing assistant work somewhere. It's confusion. Hello? You have a pattern medicine, whatever shop. You leave or even what? A pharmacy. You leave your work as a pharmacist or a pharmacy technician. You are busy looking for what to diagnose. Are you normal? Looking for what to treat and what not to treat, what you should refer the patient to the hospital for proper what treatment. You are there doing nonsense. At the end, you create issue for the what? The patient. Am I communicating? Even there are some cases you will see, you know that the patient needs proper diagnosis before recommending a particular what? Drug. And you are here, you heard the patient because you are afraid you may go to the hospital and disappear, never to come back. You heard the patient there. You hold the patient there doing nonsense because you want to make money. You are confused. You are selfish. You are confused. You are greedy. You are a wicked person. There's any adjective qualify anything bad. That's what you are. Yes. Do the ones you can do. Is self-limiting treatment. Do it and refer the patient. And any patient that knows what he's doing will always come back to you to thank you for your sincerity. If the person comes to a situation whereby he will always refer people to you as a starting point, as first port of call. He tell you, please go to this pharmacy. They will attend to you. And if it's not what they can handle in there, they will send you to the right person to take care of you. It's a selling point for you. It's what? It's a selling point. It's a selling point for you. So let us not be confused in our what? Road. That's the point I'm making. Okay, now, the next one says, how can pharmacy technicians ensure seamless care coordination? How can pharmacy technicians ensure seamless care coordination? A, by working independently. B, by fostering strong relationships with other healthcare professionals. B, by ignoring patient consent. D, by skipping medication education. What's the answer?
B.
By what?
By fostering strong relationships with other healthcare professionals.
A very strong one. By fostering strong relationship with other healthcare professionals. If you are let's assume you are in hospital setting, you must learn how to develop a strong relationship with other healthcare professionals, maybe medical lab scientists, medical lab technicians, social community health workers there, and nursing, registered nursing, or even BSc nursing there, doctors, learn how to establish very strong relationship. There are things you learn from them. It's when you interact, you know the right person. Consultants there, establish that relationship. The last I checked, here is a school. Okay, hello, are we together? Alright, so it's very important we establish that professionally relation. Very important. It will help you to even improve. There are some questions people ask you. You know exactly how to help the person and who to send the person to. Am I communicating? Yes. If you are working in community setting, you know exactly when a particular case comes. You know when to send to lab. Don't go and start mini lab in your pharmacy or proper medicine shop. You start a mini lab, start a mini hospital. There's a bed there somewhere. There's a lab here. What are you doing? What on earth are you doing? Instead, look around your locality. Get a registered medical lab there. Have establish a relationship with hospital there. Confidently walk to the doctor, the chief medical whatever there. So them may be private. Walk to pharmacy, even as a part medicine practitioner. Have a relationship with big. Don't do the pharmacy. They are not there for competition. The medical laboratory they are not there for competition. Most of them are not for competition. These are people you can collaborate with and even make money. You can establish. I see patient come here. How many percent will you give me if I send so a million of patients? Don't be afraid. You will not lose anybody. You will not lose anybody. They will come back to you. I'm telling you from experience. You will not lose anybody. There's some case is beyond where I practice. You already established, maybe you can say 10% of the charge. You send the person to the medical lab there. From there, at the end of the day, they will send you your money. And the patient will be happy that you directed him or her properly. He will call you back and thank you. Any small issue, you come to the certain point first. It's only those that are, I don't know how to describe them, people that exist, that may from. You rarely see them not coming back to you. You establish a database of your patients. have their contacts, have their numbers. After you can call them, tell them how far, how big, how hope you're okay now. The person will be happy that you get to know how the person is doing. Any small issue, the person will chat you up. Please, what do I do? Come to the office. If he comes, yeah, you must see one or two things your office can do. You do the one your office can do. If he needs a medical doctor's attention, that medical doctor, you only have a deal with him or her. You send the patient there. After the whole thing, your own tomorrow morning will send to you. You are here, referring, you're making your own money, and you're doing the right thing. Am I communicating? Yes. If the person needs a nurse's attention, you have a nurse you have business with. But you are there, you are competing out there. Even if the person needs, there's some situation you will see. You may even refer the person to the pharmacy around you. Because you know that one is beyond what your potential see can cover. Go there. And the pharmacy will be very happy that you send somebody to them. At the end, they'll send you your own word. Even if it's 5%, it's something. You have a record of whatever you are doing. At the same time, you are doing your work. They are not there for competition with you. They are there for collaboration. Hello? They are there for what? Collaboration. If you are wise and have business mind, they are there for collaboration. They are not your enemies. Roles are defined. So if you get the one that will across your road, you refer and make your money. Not to be doing nonsense in one that you're small business, running hospital, running med lab. So collaboration is very, very what? Important. I'm telling you, if money is what you're looking for, you can still make money from it. Professionally, you can still make money from where? From it. And doing the right thing, giving the patient what the patient needs. Not correct the patient and doing when the case is now worse, you abandon the patient and turn your back. The patient will go and die. You kill the patient. You heard me right? You kill the patient because you corner the patient and be doing nonsense. When it's now late, you push the patient out and say, hey, go to the hospital now. Ask, it's not true. Some of us do it. So that first relationship is very, very what? Important. Next question says, what is a solution to communication breakdowns between pharmacy technicians and other healthcare professionals? What is a solution to communication breakdown between pharmacy technicians and other healthcare professionals? A. Regular team meeting. B. Conflict resolution training. C. Active listening and feedback. D, all of the above. Yes. Because team meeting, collaboration, come together. You know why some of you will be here, you won't even know who is in the next class, in the next department until you finish here. Now, do you know why in the hostel? In your hostel, do you have hostel for FarmTech, hostel for other departments? Is that how you say in your hostel? Those in hostel, you are mixed up. So you know about other healthcare professionals because you will still need them in the field. If you see them, you know what they do. You are roommate, you have a medical lab technician as your roommate or whatever. You have a community health worker, a community health department. You have a nursing assistant department student in your room. You have what else? Public health in your room. You interact. For interaction, you know exactly what they do. Am I committing? Yes. You met them as what? Students. You learn, you fight, you quarrel, you make peace. You know what they do, what and what. Now, when you now meet them in the field, okay, it's okay, this is why they were doing those courses. Okay, it will give you that renewed instinct to see them as people you should do what? work with, not people you should fight with. You are a public health, you are a community health, two of you are fighting each other, dragging what you don't know. Am I communicating? Now, do you also know why you do general class together? They will mix you up to do lectures together, citizenship. They want to foster that what? We want to foster that what? Collaboration. Even in your exam, it's not just about the written exam malpractice. It's also part of it. Mix it up with people from other what? Departments. Am I communicating? So these things are important. It's what I feed you today. If I come and start telling you, now do you even know what pharmacy is? A pharmacy technician is a landlord. All these people are there wasting their time. If not pharmacy technician, nothing else. If I feed you with this nonsense, you finish here, and at the hospital, you fighting every day with others. You look down on them as if they came to play. Am I completing?
Yes.
That is what we are fed with in school. So if you see any doctor, any nurse, any community health worker behaving like that, don't blame the person. That's what he was told. Where? In school. Yes. The person was not trained well. That school failed. The school did what? They failed. That's one thing you need to understand. That the school where the person trained failed. And if I'm the owner of that establishment, I will not employ anybody from that school again. Once you ask that, because you are going to spoil things for me. Because that's what they were fed in school. The person didn't learn it from any other place. Am I communicating? As you are here, as far as this profession is concerned, your brain is more like taboo what? Raza. True of us? Yes. Yes, you may know other things involved, other things about life. But we train to this place, you are what? Taboo what? Raza. Your reaction, how you behave with respect to this profession is depending on what we put inside you about the what? Profession. It's normal, it's natural. So if you start feeling you that you are superior than any other healthcare professionals, that's the mindset you carry when you leave this place. You're going like this. A doctor will talk to you, so what do you know about work? And if they notice one or two things, they will not approach you again. And at the end, the patient will do what? Suffer it. Okay, the next person says, with whom do pharmacy technicians communicate medication orders and changes? A, nurses. B, physicians. C, patients. Physician, right? Yes. Physicians. I don't know whether it was in this class I told you about my encounter with when I was HOD of one hospital, their pharmacy department. The pharmacy technician under me noticed something about a prescription, and she was afraid to go and meet the doctor. I said, no, I am sending you. Go and discuss with the doctor about this particular drug. That this drug normally causes diarrhea, and this patient has diarrhea already. And because there they don't give only the prescription. What comes to the pharmacy is both the folder and that is the correct practice. That's the correct practice. What comes, not prescription sheet alone. What comes to the pharmacy is the folder and the prescription inside it. The pharmacist will look at it. Pharmacist is not there to go and start talking about maybe that this person doesn't have this, shouldn't have diarrhea. No, it's not your business. Because you not clock the patient. So immediately before that came to, because of course I train them every morning. I give them lectures every morning before work. Before I always go there as early as possible. I'll teach them one or two things before work resumes. So immediately she got the folder, she opened it. Look at what was queried at the diagnosis. Look at the drug. She saw that the drug has a side effect that may cause more issues for the patient. She came to me, she said, "Sir, look at this thing. I don't know. This drug has, on a normal, has side effect that diarrhea. This patient already has what? Diarrhea. So why did this doctor prescribe this drug again that will even make the diarrhea to be what? You see reasoning. These are the people I want to train, not robots. Hello? What I'm doing is to make it to come to that level, not robots. Robots. Leave, come back, submit, turn. No! I was so impressed. I told her, okay, no problem. It's okay. It's simple. The doctor can there are other drug that can still do the work without inducing more work diarrhea on the patient. But we will not change it by ourselves. That's what I told her. You need to see the doctor. She stood and said, "Go." And she said, "No, sir. How can I go and see a doctor?" I said, "Don't worry, go. I sent you. Just go." She said, "You are the one that identified the people." You say, "Yes, yeah, I know that I should go, but I want you to go. Go yourself." When she now went and came back, you see the joy and fulfillment. She was so fulfilled. She was like, immediately I called the attention of the doctor. The doctor was like, how? Me, did this? No, please. He changed it immediately. He was so happy with that pharmacy work, the technician. But that person has lost a lot of. Check what made the person to come to the hospital. Am I completing? The person has lost a little like that. It was almost as if after this one, he doesn't want the person will what? Place on what? Drip. Am I complicating? So the point I'm making is this, but if you don't study, how will you get to that level? That's the point. That is the point. You must study. You have to study. It's not about passing exam. No. It's not about passing exam. It's about the practice. Why I told her we need to sit up there, I want her to realize that she's not the one to change it. And I'm not the one to do what? Change it. You must call your doctor's attention. Because like, what if you refuse? What if you refuse to listen? I said, go first. Then if you refuse to listen to you, I can now do what? Come in. Lo and behold, the doctor was even impressed and happy that I didn't even appear in the whole thing. She did everything herself. But the doctor didn't know that I sent her. Am I communicating? So please, let's take what we are doing here seriously. It's about saving life. Had it been that technician was a kind of empty. Because do you know why it's good for you to be equipped? In that hospital, I was the only pharmacist there. There's no way if you see population of people, they will come. You know now, private is a private, but they are on the verge. In fact, they are doing well in the sense that, but I don't know. The other pharmacy there left, so I just joined them. So they were planning to get another pharmacist. But the point I was trying to make is that patients were lined up. Doctors did not come on time. So they were waiting after the doctor, after seeing the doctor. And you see they have population there. Then at the end of the whole thing, you now see population of people. There's no way only me can sit down there and start looking through their folder, all of them. I will focus on the one I was doing, but I empowered. I know people that it's not all of them that I empowered. It's not all of them that I gave access to folders. Some were busy counting. I know your level. Hello? But those that if not, let us assume she didn't come to work today, and that folder fell into the hand of a robot. When I say robot, you understand what I mean? I'm not saying that the person is a robot. Someone that doesn't even want to know anything. All you know is that doctor say you do what doctor say, the way it is. You cannot. You don't want to look at. I didn't mean it fell into the hand of such person, and I was busy with some other thing. What could happen to the patient? And sometimes when this patient leaves because of population, there may be no follow up. How many people even do follow up in this country? You that are small. How many people do follow up? I say how many people? Hello, how are you? How are you doing? Okay, how do you feel now? Most of us don't do it. Then, let alone that population. And once they leave the gate, they have left. What happens to the patient, we don't even know again. Some may go there and die. Next thing is that they will bring the corpse to the mortuary. He say, hey, God has given, God has taken. Some will say, hey, I said it. He's from the village. So a lot of it, at the end, it may be carelessness. Leave village people alone. It's not village people. Hello. Now the next one is what is the key aspect of human-secretion relationship with patients? Key aspect of a human relationship with what? Patient. A. They say key. Watch the word. Key word. Key. A. Providing medication, education, and counseling. B. Ignoring patient questions. C. Sharing patient information without consent. D. This one is just bonus question. If you see to answer patient consent, what's the answer? A. The next one says, what is the primary purpose of ethical codes in pharmacy practice? This lecture is going to end by what time? Is it 11 or 11 dots? 11 dots, right?
Yes, 11 dots.
11 dots, right? Good. What is the primary purpose of ethical codes in pharmacy practice? A. To establish legal standards. B. To guide professional behavior and moral commitment. C. To promote business growth. D. To enforce disciplinary action. What's the answer?
B,
right?
yes.
Now let me explain. If you are not careful, you go and choose.
A.
In fact, you're confused. Some may go and choose D. See, the purpose of law is not to punish people. It's not just about discipline people. That's the reason why it's there. To help do the right thing, right? It's when you now refuse to do that, when you now face what? Punishment. Two of us. It's not about this is why you have cane in your house or whatever. You punish. It's not about punishing them. Any punishment, any punishment you want to give that will not help to correct, don't give that punishment. It's useless. It will cause more nuisance. Two of us. Am I communicating? So the aim is not about punishing the person. The aim is to ensure that the right thing is what? Done. So the key, the very important, the primary purpose is what? To guide what? Professional what? Behavior and moral commitment. That's all. It's not about establishing legal standard. Yes, the legal standard is legal standard not established. You see it now. It does not help to enforce disciplinary action, but the most important reason is to do what? Guide professional behavior and what? Moral conduct. Because take it or leave it, you cannot practice this profession well if you lack morals. Hello? If you lack what? Morals. If you lack morals, you cannot practice. You know that if your eyes is on money too much, you stamp on moral. Hope you know. You will match on what? Moral. Because morals, if you have morals, there are some money you may not want to put you don't want to get. It's not that you don't need money. But because you want to keep to morals, you have this moral commitment. You say, please, I'm not interested in this one. Let it stay. And I know money will come out. But there are other things that can still give me what? Money. That's what I'm making. So you have to practice. That's why I made it. There was a statement I made in the beginning of this class. The first time I was with you, I think so. Most of you shouted, hey! I said, if your purpose of coming to study FarmTech is for you to make money, please go. Just go. Because you may be frustrated. Maybe what? Frustrated. And in the midst of that frustration, you lose commitment in what? Morals. Because your aim is to do what? Make money. Your aim shouldn't be to make money. Your aim should be to help save life. Of course, in the process of saving that life, money will come. Even if it fails to come the way you want it, you are fulfilled because your reason is not money. It's what? Saving life. That's what I'm making. Your reason is to save life. It's not money. I'm not saying that the money will not come or you don't need money, but that is not your primary goal. If your primary goal is to make money and your drug is expiring, you clean expiry dates because you want to make money. Am I committed?
Yes.
If your primary goal is to make money, someone comes to you, I want to do abortion, 50k, and you learn that they are spending 50k, you are willing to travel to go and get what you wait for to lose that baby, so you can get your what? Just consign you call it blood, and then make your 50k, because your purpose is what? But if your purpose is to save life, once there is fertilization, life has entered. You do everything to protect that life. If it is your purpose to save life, you will put that money and save that life by advising the person, looking for a way to help the person. If it's somebody that the parents are after, that they will kill you, you look for a way to help out. Unless the family decided to do what they want to do, it's their business. Am I committing? Yes. But the point I'm making, you do your part, because your purpose is to do what? Save life. But there are people that are wasting their life because of something. Give them 20k, they will go and get 1 or 2 drugs and give them. They want to make money, and they do it on daily basis. They want to make money. So that's why I say, if your purpose should be to save life. I'm saying, but this is not rampant. You see that fertilization, that thing you call blood, it's not blood, it's life. Life begins at what? Fertilization. I don't know what. Maybe I am speaking to somebody here. But it's true, life begins at what? Fertilization. There's no, if you like, paint it, twist up and down. At the end, you go and meet God and discuss with Him. Am I forgetting? But you have no life right, you cannot create, so you have no right to destroy. Life has entered. I have no business with that drug, so I have no business with. Hello? Don't you have right to decide what you have? Shebi, you have right to decide what you want to have business with. I have no business with it. So let's just continue. So let's continue, please. I have no business with it. I don't recommend it. I have no business with it. I don't do that. I have right to decide.
Yes.
I have relatives. Me, how?
I'm asking
Me, produce how? When, how?
No, it was asking.
So you say what? You say how? When, how?
She didn't say
Yeah.
what. She didn't say what.
No, she said what you.
She said
Hello? She patronized it. She said you.
I said you can.
Me?
Pharmacist, you
No, don't say. Don't point at me. Say you. Say hello. Listen. Hello. Say pharmacists can produce this. I am not pharmacist. I am a pharmacist. It's not compulsory that I must produce it. It's not up to you. I cannot. Hello. See, I have quit many jobs because of what I believe in.
Okay.
Understand this? I have quit a lot of jobs because of what I believe in. If I find out that whatever you are doing there will force me, if I speak to you of my beliefs and you don't want to stand by it, I'll leave your company and go my way. So it's not compulsory. I'm a Catholic. I'm a Catholic. Am I congregating? If I must not work there. Am I congregating? I must not work. What is it?
I only want to ask a question.
Ask.
Okay, now maybe somebody that like family planning. I know Catholic don't support family planning.
Okay.
Have you people now started supporting family planning? No.
What are you saying?
He said
Catholics support family planning. What is family planning?
pregnancy.
So now, must it be to drugs?
How will you not do it?
Hello, listen carefully. Hello, listen carefully. See. Hello. This life is so simple. Catholic says we don't want this. Leave them alone now.
okay, to leave it alone. Has miscarriage.
It's your business. We say we don't want this. What's your problem? Why bullying us?
No, you're not going.
It's a bully.
No, it's not.
She's twisting it.
She's only asking.
Because when there was a project.
No, listen. Hello. Listen. You see this thing. This is my 11th year. We are 25, right?
Yes.
This is my 14th year post graduation. 14 years of graduation. You think those 4 years that I have been playing? I have seen people. I have involved myself in debates, arguments. Am I competing?
Yes.
Lost many jobs, and I don't even care. So now, where you're coming from? Why I say you are bullying me? I've seen where you're coming from. You want to go and start telling me what if? I don't want to hear your what if.
Okay.
That's what I'm going to understand me now. I've heard all those what if for a long time. Stick to what you believe and continue like that.
So actually, what she was actually asking, she has seen cases of women trying not to take medication and also trying to prevent pregnancy, and it's not working. At the end, they will try to terminate the pregnancy or do something else. So, how in that case, when someone comes to your facility like that, what are you going to advise the person if you are the pharmacist? No.
Please, hello, listen.
That's the person.
Hello, listen. I am not the only pharmacist. I am not the only what? Pharmacist. Hello? Understand how things are done in this life. Listen carefully. I am not the only pharmacist. I choose who I talk to. I am not the only pharmacist. Am I communicating? Listen carefully. I am not the only pharmacist. People want you to tell them what they want to hear. You cannot hear it from my mouth. There are others that may even tell you, take this, don't worry. You go to them. I understand that I am the only pharmacist in the whole world. Then we cannot talk and start to discussing. Am I competing? what you go to somebody, tell them what I believe in is what? Natural what?
So what are the natural natural?
We are not in that class now.
So it's part of the class.
No. That's wrong. Say no.
So it's part of the class.
We are not in that class. Listen carefully. There's no way, there's no place you do the rope on your neck.
You want to learn and start with you.
No. You know what you want to do. You want to open up arguments. Listen. Hello. You want to open up, making me see reason why you should. That's a simple thing. I'm not a baby in this field. Listen careful. Hello. When I say I'm not a baby in this, I know what I'm saying. You want to open it and make me see reason why there are some people that should. That's what you want to achieve. Then talk to me privately. Let's talk. If you want to know, if truly want to know, because the question you ask me, what if? Once you start hearing what if? Once you start hearing what if, the person already has what he believes in mind. You want to see. Hello. There are people that say we don't want blood transfusion.
Yes.
Leave them now and go your way.
Yes.
If you have a hospital, hello. If you have a hospital, listen carefully. If you have a hospital, hello, and they come, the only thing you need to tell them is this. The only thing you need to tell them is this. Please sign consent form that you don't want transfusion. And if their daughter or son die, they will not even be angry. They will be praising God that is in heaven. What's your problem? No. See, the person died, sacrifice his other belief. Leave it to them. Believe. And let's assume I am in that line that I don't believe in transfusion and I have hospital. Since I don't believe in that, once I start sensing a case, once I start sensing a case that will lead to that, I will do what? The first sharply. That's the point. Am I the only hospital?
No.
What's your problem?
Ask me.
People have their beliefs. Leave them to their what? Believe. If you are confused, you want to join them, join them. You don't want to join them, pay your own lane. Hello. This life is so simple. You sweet and put a hand here. People have what they believe in. And it works for them, and they are going with it. When they are being, this life is filled with beliefs. There are a lot of belief systems. Understand that I'm having, and you have to respect it. Don't go and start arguing there. What if you're wasting your time?
Now what she says that as it's part of your profession, right? And you agree with it that it's your profession, part of your profession.
To do what?
No, not to do. As in this family planning program, drugs and prevention is part of your profession. As a pharmacist.
As
Is it part of the profession? Yes. As a pharmacist. Yes.
Part of profession. Let me.
The drugs and the other method. Okay, as a medical practitioner, right? It's part of your profession. So you agree with this is part of our profession, right?
To do what? See, anything drug is your profession.
Yeah.
So what? This question is not necessary. That's what I'm going to. But yes, it's part of it. Hello? It's part of it, but you still have right to choose.
chooses this, who will you serve?
See, anything drug is part of, but you have right to choose what you want to do. Am I communicating? All you need to do, please, I don't attend to such cases. I'm not the only pharmacist. Go to other pharmacists. It becomes an issue if you don't want to refer and you are there, tell the person, you must stop. If you don't do this, you go to hell, you are foolish. Hello? You now hold the patient. If you do The other one, if you don't go natural, you go to hell. I'm telling you now, you are wasting your time. That's the way you are going wrong. Because you cannot force, you can't force what you believe on them. That's where you're going wrong. And some people may be doing that. You go to the question and start preaching. Who are you preaching to? Who sent you? Please, when it comes to this contraceptive, please, I don't deal with it. Please, where do I go? Please, there are other pharmacies you can go, no problem. And person quietly do what? Go. If the person now come personally say, there will be something in you that I want to understand. Please, I want to tell me why you want to do this. In case, let me understand. Please, it's not that I just want to learn so that I will know what I'm doing. You can simply sit down and explain your reasons for that. All together. Explain your reasons. Maybe the person may even join in your what? Belief. But not to argue or to force somebody to know. Am I complaining? Money na my money. Hello? Stock in my stock. No person in the whole world can force to do that. It's not done anywhere. Are you aware? It's not done anywhere. Then if you are working in a particular maybe hospital or pharmacy and you notice that they cannot allow you to do what you believe in, don't go there and start dragging things with them. Do what? Resign and go your way. You are not condemning what they do, but you have your own what? Belief. Am I convinced? So that is the point I'm making. So that's why whenever I start hearing what if we end up in arguments, you can never solve any problem. Because the person is trying to show you, tell you reason why you should do that. Hello? So the right thing is this. If you know cases that will start leading to what you don't understand again, the best is to leave it. Go your way. Am I convincing? Yes. But if I'm in class, like now, if I'm in class, I'm teaching, and it's in the topic, it's a general knowledge you teach. It's not a personal thing. I teach because I teach. That's what I teach. I teach it. You know, the difference between personal and even if you don't teach it, it's there. This is what in fact, it's even better you teach it. Those that want to practice it will know truly what it is. Know their makings of actions. Am I completing? Yes. Even before I became a pharmacist, I know about it. I was against it. When I now became a pharmacist, I went into how they act, and it cemented the belief strong as hell. Hello? My knowledge now cemented that belief. It is now raw. Unlike before, it was just what I was told in the church. So when I now went deeper, it made it to be stronger, like rock. So that if you want to bring up argument, I'll leave you and go my way. Believe what you want to believe. Allow me in my own. We stay in peace. It's not true. We stay in peace. We stay in what? In peace. There are other things that can bring us together apart from what we believe in. Two of us. So that's the point I'm making. So I wouldn't want to come here and start calling any drug and start telling you what they are doing and why they can't do it. That's not what we are doing here. Okay? That's not what we are watching. Just take it like that. There are some things I cannot get myself involved in. Just the same way, some people cannot get themselves involved in blood transfusion. And I cannot blame them. It's what they believe. They are the reasons. And respect for them. And if you are working in the hospital, the only thing, as I said before now, is to give them form to sign. You cannot force them. You can't do what? You cannot force them. Then those that are among them that have hospital. They know how they avoid all those things. They know how they do what? Avoid all those things. They are what believe. Me, I believe in blood transfusion. One should transfuse. But I cannot go and start blaming them for what they don't believe in. The same way, when I tell you the part I don't want to involve myself in, respect it and be. This life is so simple, it's so sweet. It's sweet and complicated. It's sweet and do what? Complicate it. And the next one says, which ancient documents focused on respecting individual autonomy? Which document? As if this is what we just discussed now, three of us. What ancient document focused on respecting individual autonomy and informed decision making? A. Geneva Convention on Medical Ethics. B. Hippocratic Oath. C. Nuremberg Code. D. Declaration of what? Helsinki. What's the answer? What's the answer? I've worked in some hospitals. Even some pharmacies. The first pharmacy I worked in, the person doesn't sell anything that has to do with contraceptive. The only contraceptive he was selling was condom. Hello? The person, the only contraceptive he was selling was condom. Anything drug doesn't involve himself. And the man is a millionaire. The man should be a billionaire by now. That guy is in money. Is what? And people know him for that one. They know him for that one. Don't come and start. Don't come to his pharmacy and start saying you're on your own. He won't talk to you. He don't sell it. Am I committing? And he had reason why he sells only condom. He believes that condom can prevent diseases spreading. Understand him now. That even some families, some couples, because of maybe exposure to HIV, the one that has it will be using condom for what? Sexual what? Do you not see his now? But apart from that one, any other one, but there are some they sell both the one that for abortion, the one for everything. They say go to go, they don't care. It's their business. It's their what? It's their business. You can't condemn them. It's God that knows how He will do everything. But so far you believe in this, don't believe in this. Maintain your lane. That nobody will say, nobody put ropes on your neck and say if you don't sell this now you're no longer a pharmacy. It's not true. It's not written anywhere. It's only when you keep that patient and start forcing the patient to accept your belief. That's when you are committing what? A very serious what? Crime. Okay. Now next one says, what are the 6 core ethical principles? What are the 6 core ethical principles? A. Honesty, integrity, respect, compassion, competency, and loyalty. B. Honesty, promise keeping, non-efficient, beneficence, autonomy and justice. C. Respect, empathy, confidentiality, fairness, and accountability. D. Professionalism, teamwork, communication and patient what? Okay, what's the answer? B. B is what? Honesty, promise keeping, beneficence, autonomy and what? I agree with you. The next one says, what is the significance of the Declaration of Helsinki A. It emphasizes guidelines for human experimentation. B. Highlighted the importance of voluntary patient consent. C. Established the code of ethics for pharmacists. D. Promoted pharmaceutical research. What's the answer?
B.
B is what?
Highlighted the importance of
Voluntary patient what? Consent. Voluntary patient, you don't force the patient. Am I completed? Voluntary patient what? Consent. Alright, now the next one says, who emphasize the importance of honesty, integrity, and compassion in medical ethics? A. Albert Johnson, Hippocrates, Florence Nightingale, Immanuel Kant. About what? Who? Johnson, good. What is a key component of professional behavior for pharmacy technicians? What is a key component of professional behavior for pharmacy technicians? A. Self-discipline and self-regulation. B. Adherence to legal standards. C. Maintaining patient confidentiality. D. All of the above.
All of the above.
Yes, all of the above. I agree with you. What is the primary responsibility of pharmacy technicians? A. Assisting pharmacists in providing patient care. B. Maintaining inventory and supplies. C. Handling customer inquiries. D. Managing pharmacy finances.
A.
A is what?
Assisting pharmacists in providing patient care.
Okay. One thing in the pharmacy technician code of ethics emphasizes respecting patients' rights. What thing in the pharmacy technician's code of ethics emphasizes respecting patients' rights? A. Maintaining health and safety. B. Honesty and integrity. C. Respecting patient autonomy. D. Professional competence.
C.
Respecting what?
Patient autonomy.
Yeah, don't force them. Don't just know what they believe in. Just tell them. All you need to do is to tell them, help them to make an informed decision. Tell them what and what is involved. And if they do this, this will happen. If they don't do this, this will happen. And allow them to do what? Decide. Okay? But if their decision may implicate you tomorrow, you give them something to do what? Sign. So that when it happens, they will not blame you. If they want to make a case out of it, you show them what they did what? Is it clear? That's the point there. Next one says, why is loyalty to the employer important for pharmacy technicians? Why is loyalty to the employer important in what? For pharmacy what? Technicians. Yes, you should be loyal to the people you are working on for. Am I communicating? So far you want to be there, you have to be what? Loyal. But if there are some things, as I said before now, they are doing that is against whatever you believe in or whatever you stand for, instead of being there and be causing issue there, committing nuisance there, becoming disloyal there, and be, causing a problem, that one is not good. It's not a compulsory you must work there. The best to do is to do what? Go leave that place. That's best to do. But so far you are there, you must be what? Loyal. It's more honorable to leave and you are expected to be there. And you may even have a relationship with them tomorrow for other things. Than you are there and mess yourself up, or maybe they will sack you. You not even see the face to come there again for other. The people you work for today may be your business partner tomorrow. Three of us. So depending on how, once or sometimes you may even be working in a place you are tired. As in you are tired. Don't stay there because of problem. You're not going to work on time. If they ask you, you say, why would I? Can't you do that one? Can't you do that? No. once you notice that you are tired, you are becoming uncomfortable in that place, do what? Good. It's more honorable. I do it. I don't do it. Once I'm becoming uncomfortable, I will just resign. I don't waste time, because anywhere I am, it's either I'm there, I am not there. If I'm there, I will be there with my heart, with my body, with my soul, with everything in me. If I'm not there, I am not there. I will leave and go. And all the places I've worked, they know that, they know me for that. If I'm with you, if I'm with you, I will just give you. You see, you know that I have left. But if I'm there, I will there committed in doing that thing, and that one defines you. Because tomorrow you don't know who will refer you. You don't know who you will meet tomorrow. Am I committed? So please, that's what I'm making. If you are there, you must be loyal to the company you are working for. Unless they are not what they do, you don't need to be loyal to such activities. You go. Don't be afraid that hunger will kill you. Go. Hunger will not kill you. It's better you go. So why is loyalty to the employer important for performance technicians? A, to advance career prospects. Have you seen it now? 2, to maintain professional standards. 3, to support pharmacy's what? Mission. D, all of the above. Yes. To advance career prospects. Yes, prospects. Somebody tomorrow, you may go to somewhere tomorrow. They may talk to them behind your back. Who is this person? You may not know. They will see your CV. They want to know where you have worked. If you go and start lying that you worked in some place, and they now want to contact them, they cannot contact them, you are in trouble. And if they contact them and they say we don't know that human being, you also in what? Trouble. Am I competing? Then if you now put address of contact of where you worked, and when you were there you were doing nonsense, and that problem, then you say you have not worked in anywhere, so you ask, so for the 5 years you have graduated, you have not worked. It's also a problem. Hope you know, because they will query your capability. Yes, so you must have worked somewhere. Then you say you just graduated. Some may go to the extent of contacting your school behind your back, and they will now contact me on your behalf, and you are doing nonsense here. You will think I will defend you. I will defend you. I will say what I know about you. Pure ED. I will not hide it. So if you are here, organize yourself, respect yourself, and do the right thing. Some of my lecturer from school are still following me up to today. Yes. Everything I'm doing, they are still following up to today. So anything I post on myself to that, they want to comment on it. This one you did, do it this way, do it this way. Your lectures should be doing, okay, add this one. Till today, I left school when? 2011. How many years now? Till today. This your video, this lecture, this topic, why not do it this way? Do it this way, add this one, you know. Those things they were doing that, they were still doing it today. If I messed up with them, if I was doing nonsense, do you think they can be doing that? Would they even have my number? I'm telling you, WhatsApp status, not even Facebook is there. I'm talking about WhatsApp status. How many years ago? So them I've not set my eyes on them till today. What point am I trying to make? If you are here, Here is like a rope tying you in your waist. Anywhere you go to tomorrow, they must hit back here to get your information. So don't say that is all. Your file is there. And thank God, with time now, file will become digital, no longer hard copy. So you say, the nonsense you did, your file, you open it. When she was there, she was fighting lecturers. She did two things with lecturers, and they will be scared of you. What point am I making? You cannot escape it. Any path you take will keep following you. So if you did well in that path will remain there for you. So don't think when you are done here and go, that is the end. No, it's not true. It's not the end. It's not the end. So be careful about what you do here. Hello? Hi. What I'm seeing, what I'm talking about now sounds somehow, but it's a fact. It's a reality. You won't understand until you go, you live here and start working as a performance technician. You still do. Hello?
Hi.
Hello?
Hi.
All right, I think we'll stop it for today. Huh? Make what? 60. Is that what you mean?
Yes.
Where that will stop, sir? Okay. Hello?
Hi.
You're making noise now. What is the issue? I know you're tired. Don't worry. Let me just round up. How should forget about the numbering? Look at the question. That's the most important thing. So that numbering will confuse you. How should pharmacy technicians approach ethical issues? How should pharmacy technicians approach ethical issues? A. Consult colleagues and supervisors. B. Consider all parties involved and assess what? Risk. C. Follow legal standards only. D. Make decisions based on personal opinion. What's the answer?
B.
And assess what? I think we'll stop here. Thank you for spending 2 hours of my life with you this morning. So, in our next Thursday, we'll continue from where we stop. 9, okay, sorry. I will Thursday is by our time. So 3 p.m. dot. Once I come here, please, immediately, don't waste time. Immediately. So, prepare yourself. By God's grace, this will be marked sharply. Those that could not write today, I'm sorry. I will sit down one-on-one, write it in my presence. So I'll tell you when it will be, don't worry. I'll tell you when it will be. And how it will be.
Last week.
So, sir, you did not tell us that you are going to start this 9 o'clock on the.
No, last week. One of those that did not miss their last week. We will join it together. Last week.
Don't worry. I'll take it away. Hello. I said, I made it clear to you that any contact I have with you from now to the exam, I must be peace. And as I'm entering the pattern, even if it's only one person there, right?
This 9 o'clock, can we do that? Or even by so far distance.
Alright, thank you very much for your attention. See you when we see.